So without further ado, can I welcome our first speaker for the day, Don Palmer. Don is the founding CEO of the Malpa project, which is and was created to provide Aboriginal inspired and led approaches to improving health outcomes. And he'll be presenting today on the Young Doctors for Life program. Don, over to you.
Thank you very much, Tom. I've lost vision. It's just come back now. Thank you. Look, thank you to Poche for allowing me this opportunity. I really appreciate it, and I've particularly appreciated Yvonne's help in getting everything ready. I'm speaking to you. I'm sitting on Guringai land in northern Sydney, and unfortunately, to my knowledge, there are no more Guringai people at all. And that for me underscores constantly the need for the kinds of things that we do. Our organisation, and I'll just share the screen here. Are you getting that screen?
Yep.
Yes. Okay, our organisation is called Malpa, and it's the name chosen from the Pintabee people of the Western Desert, and they told us that that was the name we should call it because it means friends on the journey, black and white doing something successfully together. The project that we run is called Young Doctors for Life, and it's based on the Central Desert approach to achieving good health. And the short story goes like this. I was spending time in the town camps around Alice Springs as a filmmaker, and I was overwhelmed by how sick people were. The children, the older people, the parents, everybody had multiple comorbidities, and everyone was younger than me. All the old people had died, and this was profoundly sad to me. So I asked my friends, elders in that situation, some Pintabee and some Walprig, why does nothing work? So much money's spent and everybody's sick. And they said, well, it's because nobody ever does it our way and nobody seriously includes us. So we had a conversation around what that could be, how we could create something that not only was co-designed and run by the local people, but reflected an Aboriginal model whereby the Nunkari, the traditional healers, would choose children and they would start to raise them as young doctors or young Nunkari with the health knowledge. And I've got a very short video here from Uncle Jack Charles, I think, who explains the essence of it very quickly. So let me play that for you. Sorry.
Yes. Don, it's Yvonne.
Yes.
Others are having trouble hearing your video. So if
Yes.
you can just share the audio of your Zoom.
The audio is embedded on the video.
Okay. So what you'll do, if you hit
On the right.
if you hit stop share, there's a button that you need to select that says share audio. So that may not be selected.
Just trying to get, no, I'm not having success in that. So I'm happy to jump forward. So you're getting that image?
Yeah.
Yep.
Okay, so in a nutshell, what we do is that the children, the young children, senior primary school kids, are taught the old ways of medicine by local Nunkari or local traditional knowledge holders or elders who know about the traditional ways of health. They're also taught new ways, the modern Western ways of medicine by paramedics, doctors, any health and allied workers who come and deliver practical sessions for the kids and start to equip them and empower them with the health knowledge. We've got projects all over Australia and they're always called by the names in the local language, like Namaji and Deli doctors and Nagan doctors. And strengthening culture is an important part of what we do overall. The general areas that the kids learn in are these 6 here. The most important actually being well-being and identity. These kids have seriously difficult lives, and they need all the resources that they can to cope with not only the situations they have, but the situations that are coming down the line for them. So on any given week, this is what might be going on. So the Namaji doctors will be studying bush medicine and bush tucker. The Dalai Mala would be doing CPR, learning about how to make emergency phone calls. Wisdom of the elders, medication. This is whole, incredible, rich variety of the thing. The structure of our organisation runs pretty much like this. So, and this is the most complex slide, I should say. So there's 15 young doctors. More than half have to be Aboriginal, but we always include non-Aboriginal kids. And the reason is because the Dungari elders said that we must have non-Aboriginal kids. And I struggled with that for a while because I thought the need was mostly with the Aboriginal kids. In actual fact, it's the best thing we've ever done. It brings about a beautiful natural sense of reconciliation and deep friendships and shared knowledge, elevated respect. It really ripples everywhere. It's terrific. The project runs for 15 weeks in a school environment for an hour and a half a week. The projects are evaluated. We have 2 paid staff who are always local people. All the people delivering and designing these courses are local people, local doctor, local elders, whatever. We pay for all the financial side of it, including excursions, and the staff who run the projects get ongoing support from us. It operates in grades 3 and 4 level and in grades 5 and 6 at an elevated level, and where there's a greater emphasis on being health leaders. And one of the things we've found is that you get a shy child comes in and starts the program in grade 3 and they end up the school captain. It's uncanny how often this happens. They develop a very powerful sense of their place in relationship to other people. The project includes incursions. So whoever the local group thinks knows things that they want to know, they invite them in to do a hands-on session. So the kids learn from very high-level professionals who are in the area. They also do excursions, go to the AMS, hospitals, to culture sites, so that they start broadening their horizons and getting an elevated idea about the kinds of job opportunities there are out there and why it's really interesting to know about this stuff. So far, we started 8 years ago with no kids at all, and one project 12. We've now got more than 2,500, and we've got 650 more to be trained in 2022. So what's the impact? Well, the impact is really quite profound. If there was only one single measurement of the impact of it, it's that we get 100% school attendance wherever we operate. And that school attendance remains on after the project has finished. It really empowers kids. In fact, we had one project where there wasn't 100% school attendance. Instead of 15 kids, we had 39 kids would turn up to do this, not one afternoon a week, but every afternoon for 15 weeks. And this is because what's being delivered is relevant to them and it's fun. And the kids really, you just can't keep them away. Further impact has come from the way that they share their knowledge. This is transforming people and communities. So they take this knowledge home. The parents start eating different food because the kids talk about it. The kids start looking after their room so their hygiene's better. The kids start making all sorts of changes. And here's a young Dalai doctor in Kempsey, and as part of their graduation, they conduct basic health tests on all the young kids in the rest of the school. It's incredible to watch. For me, it's incredible to watch children teaching children and sharing knowledge. It's so powerful. Now, it's often been said you can't be what you don't see, and I think that, dare I say it with respect, that so often Aboriginal kids only get elite footballers put up as role models, and I think we can do better than that, or better should be done for them. And that's why the Australian College of Emergency Medicine and the Indigenous Doctors Association approached us and said, what you're doing with the kids is the ideal age to start creating career pathways. So we work with them and we consult with them to help progress that as an idea. It's a unique project. To the best of our knowledge, there's none other that's working like it. And it's successful, I believe, because it's done the Aboriginal way, as the elders advised us to do, and it is done by the local people. We were very flattered to get this evaluation of our project from Corinne Walsh, and we didn't even know she was looking at what we were doing, and she came back with that, and that gave us great heart. So that's our project in a nutshell: clear heads, strong hearts, and long lives. And we just do what we can, and we pay tribute to those in communities who pick up the initiative, create really interesting educational environments, and give those kids a better chance at making something of their lives than they might otherwise have had. And so that, friends, in a nutshell, is what we do.
Really set the pace, dead on time, and you allocate 10 minutes was done. So hopefully you'll be the pathfinder for those to follow. That was great. So do we have any questions, Yvonne?
We do. We have a question from Liz, Professor Elizabeth Elliott, who asked, who funds the program? Is it restricted geographically, and can Aboriginal communities make an application to participate?
Yeah, thank you for the question, Liz. Liz, our policy only go where we are invited. And that's a very important thing, so people can check us out thoroughly before they approach us. We're funded, we get no government funding at all, and we never have. We're funded by corporations like Johnson & Johnson. We have another major family who funds us, and then individuals who join in on that. So that, yeah, it's entirely self-funded. Our annual budget at the moment is about $750,000. Does that answer your question, Liz?
Yeah, I'm sure it does, Donna. And on your website, there's, I guess, a link on how people can make a donation, should they choose to.
Yes, indeed. And if people are interested in our project, we'd be very happy to hear from them and start that conversation. And our conversations always start with the local elders and move from there. We always move as respectfully as we possibly can and give ownership to the community to do it their way.
Yes, and we have another question, Yvonne?
Yeah, we do. We have one from Joe Gwynn. Have you had many young people start or intend to start in health careers? And do you have any statistics on that?
Joe, we don't have statistics. As I say, we started 8 years ago, so those kids are just finishing HSC, and we haven't done any longitudinal, formal longitudinal evaluations. What we have done, because our leaders live in the themselves, they personally see what's happened for the kids and what they've been able to make of their lives. Nobody's actually, I'd love to say that somebody's going to be a doctor, and that will eventually happen, I'm sure, but I always remember what Uncle Jack says when he goes to, Uncle Jack Charles, when he goes to graduations, he looks those kids in the eye and he says, I don't care if you collect rubbish or if you're a surgeon, be proud of what you do and do it well. And I think that's a good message. We're not necessarily trying to create career pathways for doctors, but we want these kids to have a strong sense that life is rich and that they can grasp the opportunities that they want to, and that they can dream realistic dreams.
I just want to apologise. That was Joseph Freeman's question, not Joe Gwynn's. We do actually have one more question.
Mm-hmm.
Do you have any health outcomes? How has the health of communities improved?
It's always a difficult thing to sort of say this health fact has changed because of this project. There are so many things happening in the lives of children, and to attribute causal effect is very difficult. One thing we do know is that the Aboriginal communities we work with are deeply suspicious of being constantly evaluated. Mm-hmm. And I remember one old Yellow man said to me up in Arnhem Land, he said, you know, you old white fellas, you know more about me than I know about myself. So we try to keep the evaluation of what we do very, very light indeed, and any information, any thoughts and responses we have are always shared with the community. We know that the parents report that they're eating differently. The kids have got better hygiene habits. The kids know how to blow their nose so they don't. They're less likely to get otitis media. We know that the kids are sharing knowledge with their younger peers. We know that they're less afraid of going to a hospital or a medical clinician. They're more in control of their own health. And it varies slightly from place to place because every program is responsive to its location and emphasis is different. For a quick example, in Kempsey, there's dreadful problems with otitis media up there, absolutely appalling, and almost nothing being done. The kids now know how to look after themselves in terms of facial hygiene and what have you. These things have rolled over into the whole COVID thing. But if we tried to measure everything, we'd be putting half our budget onto measuring. We know people want it because the kids keep coming. And the kids keep coming because it works for them and it's enjoyable. And 100% school attendance, which blows me away every time. But that to me is the single most important fact in this whole thing. And if they're doing that, everything else will flow from that. If they're not at school, stuff's not happening. If they're at school, terrific stuff's happening.
Thank you, Don. And on your website, would you have a list of all the communities where a program's been run? And I ask that question because many people online will be doing research in probably some of those same communities. So the research that they're doing, and I know from the Poche perspective in New South Wales, if there are communities there, we could get an idea about the health impacts through that research. And I guess the other question is, and I know you mentioned that communities don't want to be overly evaluated, but would you be interested in any of the researchers making contact with you about maybe looking at developing some evaluation projects that you might be able to put in some bids for?
Thank you for that, Tom. I would be very interested in that. We've currently got a PhD student studying our work generally, but particularly in Kempsey. But we would be interested in finding sort of respectful ways of evaluating that, so that we can track what we're doing. Certainly, the idea of schools on the website's an excellent one. We've got 40 projects running next year across South Australia, Victoria, and New South Wales, and that may be expanding in other things. But I think the idea of putting the schools on there is an excellent suggestion.
Good. Okay, well, that's no more questions, folks, that we've got. Well, thank you, Don. I really appreciate that, and it's inspiring.